Now, I want to have a look at your hips from the back, so I'm going to stand behind you. That's it. I'm going to climb up on the block. I'm going to kind of look down your back body. May I touch you?
Mm-hmm. Sure.
Okay, good. I do not see any particular rotations here, Kathy. That's good news. I don't see any lateral curve in the spine. That is very nice. I think what we're dealing with really is what's happened in this knee because of the hyperextension.
So how does that affect this muscle right here and make it, is that just from the sitting too much?
No, it's not, because when the tibia, when the top of this bone comes too far back, say, right, this digs in, then it's going to create a strain pattern all the way through the front here. Yeah, so it makes perfect sense, really. Now, the sitting is going to be aggravating, truthfully, but I think if you come lying down on your back, what we'll find here is we can create a pose that might really help. Do you know bridge pose? Do you like it?
No.
Ah.
It really pulls on my knee.
Aha.
Which I know it's probably good for it, but it's like it hurts.
Right. So we're going to see if we can find a way that it doesn't. So if you'll lie down there. And because of what you've told me about your connective tissue challenge there with the autoimmune, instead of having a block under your sacrum, we're going to have you lie down, just lie all the way down. And as you know, when you do bridge, you don't put anything else under the head. If you can press your feet down, lift your hips up, and I'm going to bring this right underneath you. Does that feel even? How are we doing so far?
Good.
Okay. Now, we're looking, remember, to affect the lines, myofascial lines between here and here. So we're going to work a little bit differently in this pose. Take your arms out wide to the side, maybe a little lower than shoulder level. Good, a nice tripod. And just spin the arms. Good, you've already done that. And we'll step the heels slightly back toward the body, so there's more of a verticality there. Good. Yes. Good. So the lumbar feels really supported.
Okay, there.
This is a good way for you to practice with the bridge pose because it's going to give your lumbar some nice support, and we're going to be targeting, excuse me, there you go. We're going to be targeting an area here that I think is really going to help. Now, on this one, we're going to have the heels lifted up off the floor. So you'll find that you'll need to slide your heels even closer into your body, come up on the toes, and we're going to have the first metatarsals of the feet, and that means these long bones here stay parallel to each other. So I'm going to kind of set them in that. The base.
Brings my knees together. Is that okay?
See if you can keep your knees hip distance apart. In fact, let's do this. All right, now this is a test just to see how this feels for your knees. You're already feeling you're activating some muscles from the inner arch up into the knees. Is that true? Good. Now very slowly begin to lift the hips and just monitor what's happening. Just supporting the block.
That's as far as I can go.
Is there pain anywhere?
Yeah, what happens is this other side of my leg, this down here, whatever connects, is really pulls.
And what you're feeling is that it's really working. It's really working harder. So is it pain or is it just an unusual?
It's not unusual, it's just uncomfortable.
Yeah. Yeah. All right, so one more time, let's lift up. And slowly coming down. And now I'm going to remove the block, place the feet flat, and just notice how the knee feels. Okay so far? Okay. Now, I'm going to have you place your fingertips on your frontal hip points, just kind of like you're holding your pelvis lightly, and then slowly extend your right leg long. As you slide it out, I want you to imagine you're placing the bottom of that foot on a wall. Good. And I'll create that wall for you. You're going to see if you can press into the wall with the base of the big toe. Remember that pressing with the base of the little toe. We'll keep that neutral rotation here. Good. Not the toes themselves. The toes themselves pull back toward you. Good. Good. How does that feel, Kathy?
Feels good, but again, my little one just isn't there.
Right. But it will be. It actually is, the way that I know that it is actually working is that the little toe is swinging out to the side. So that's a good sign. And now slide that heel in and try the other side. This is a nice one for you to do at the end of the day after you have been sitting, because it's going to open up this front line, yeah, and it's going to work that foot and knee the way that we want to. Now let me get a little bit more detailed about it. The right leg lengthens again. Right leg, yeah. Good. Now you press the base of the big toe. Now another thing that we want to do here, in addition to just pressing forward like you're stepping on the gas, I want you to imagine there's a magical fluid in that imaginary wall and you're suctioning it back through this part of the foot, like you're pulling through the arch. And you can feel that that action is pulling right along here and right along here, like you're really drawing back as you pull the toes toward you. Yes, so it's sort of a detailed action, isn't it? Yes, good, good. Now as you do that, keep the back of the heel pressing down and let the knee very slightly lift, just very slightly, good. Because what I'm doing here has more to do with energy, the movement of energy through the myofascia and the meridians than anything else. So as this knee stays open, in other words, you don't let it hyperextend in this position. So you press the back of the heel, keep it out of hyperextension, press forward through here, draw back through here, and then lightly draw your frontal hip points toward the midline of the body. So that's that light cinching of the transversus muscles of the body. Then you can take your arms out to the side, extend your left leg long as well, create that same action in your left side, drawing the lower tips of the shoulder blades toward the blanket roll so you get a nice opening across the upper chest. And with both legs, you're really working the back of the heels down to pull the knees out of hyperextension, yes. So it's really, anybody watching this would think, well, she's really not doing anything, but you're doing a lot of work there, aren't you?
Indeed.
Indeed, a lot of work. All right, and now relax that completely and bend the knees.
Does the zippering keep you from arching your back?
Yes.
Arch my back.
Yeah. Yes, exactly. Yes. So this is actually, in the time that we have, this is actually how I would have you work. And also that the action in the foot that I have showed you, particularly in your classes that you're doing or your yoga practice that you're doing on your own, when you do any standing poses, particularly think of the standing poses where the leg is straight. Say Trikonasana, this one, Parsvottanasana, these poses where the front leg is straight, you want to always suction through the bottom of the foot, root through the base of the toes, so that you take that hyperextension out of the knee. Those are the poses to be very cautious of when you have a hyperextended joints that are starting to really show up. This is, to me, it seems pretty clear that hyperextension's always been there in both knees. And that was when you jumped from here to here, that knee went, that's it, that's enough, yeah? Chances are it wouldn't have happened if there was more congruency in your joints. So backing out of that hyperextension will be really the way for you to go in all of your classes ask your teachers to say, would you mind to give me tips on how not to hyperextend?
Mm-hmm.
So it keeps reminding you. Does that make sense?
It does. One of the prompts that our yoga teacher says is to, I forget what she says, but you sort of firm around your ankles and firm around your knees, or if you're on your hands, you firm that joint.
Yes.
So I think when I do that with my knees, I tend to probably hyperextend even more
Yes.
because I'm tightening my kneecap. So what would I do with that?
Just exactly what we've done here today. For instance, just watch me, and I'm going to pretend that I'm a hyperextender, which I'm actually opposite from that. But say I'm hyperextending. If I do that, I notice that when I hyperextend, it throws me into the outer heels. I'm going to kind of mimic what your body's doing, and I'm supinating. So if I feel that, instead of firming and pressing back, I want to lift my toes, take the roots of my toes down, draw up through the arches, and bring the knees out of that hyperextended state. So it's not a firming back, but it's a drawing forward. Yeah. See, the thing is, that's a very good instruction, firming around the joints. But hyperextended knees, they'll hyperextend any chance they get, because that's normal to them. Mm-hmm. So it's your knees are hearing the instruction differently than the teacher's really intending the instruction to be. Mm-hmm. So it's always really good to tell your yoga teacher, I'm very aware that my knees hyperextend. Any help you can give me on that would be greatly appreciated. Okay. Yeah, okay. Yeah. Okay. So.
Well, thank you.
Well, thank you very much.
It's very helpful.
Yes.
So I'll see you next year and let you know how.
Yes, wonderful. Thank you, Kathy. Namaste. Namaste.